Pradesh allopathic private medical care establishment part 4. In this we will discuss about the appendix 1. You can see in the rule 4 of H, minimum standards for the registration of private medical care facilities. Part 1. Background and rationale of setting minimum standards. In terms of the provisions of the Andhra Pradesh Allopathic Private Medical Care Establishments Registration and Regulation Act 2002, and in order to have successful legislation, these minimum standards are prescribed for the different types of the private medical care establishments for the effective implementation of the Act. These standards may be modified by the state authority from time to time and shall be maintained by the private medical care establishments for getting the necessary registration of the facility as per the Act. These minimum standards have been prepared with discussions held with various healthcare professionals and also with the active involvement of the representatives of the AP Private Hospitals and Nursing Homes Associations, Indian Medical Association, Indian Medical Council, and various government functionaries, etc. The minimum standards set for different types of medical care establishments and comprise of general requirements and specific requirements and include physical standards of space requirements and hygiene equipment requirements for delivering specific services and manpower requirements and their qualifications. These minimum standards explain about the obligations of the private medical care establishment towards the patient, society, and staff engaged. See Part 4. The standards also specify the minimum list of services for which the medical care establishments need to display the charges levied for the benefit of the patient information. See the Part 7 for this. The minimum standards also specify the medical records and other records to be maintained, to be made available to the patients, records that need to be made available to the inspection authorities, and filing of minimum data returns to the appropriate authorities. For example, data on notifiable diseases, detailed births and deaths records, and patient and treatment data, etc. You can see in the Part 8. 2. The classification of the private medical care establishments. In the context of working out the minimum standards the private medical care establishments in the state of Andhra Pradesh, the following classification is made depending upon the services offered by these facilities and also on the physical infrastructure available within them. A. Classification based on the services offered by the facilities. 1. Establishments offering the medical and surgical treatment, clinics and consultation rooms, that is dispensaries. 1. Hospitals or nursing homes offering basic services and family medicine, that is primary. 2. Hospitals or nursing homes offering basic specialty care services, that are secondary. 3. Hospitals offering super specialty services, that is tertiary. 4. Physiotherapy centers. 5. Dental services. The services offered by these facilities are described in the following paras. 1. Clinics and consultation rooms, that is dispensaries. The clinics and consultation rooms are facilities run by a solo qualified allopathic doctor, either with MBBS degree or with higher professional qualifications. These facilities offer outpatient treatment drug prescriptions based on the investigation support sourced either from in-house labs or from outside lab facilities. The range of treatment offered by these clinics depends upon the qualifications of the medical practitioner. There are polyclinics which are operated by a group of 2 or more practitioners. These two types of facilities refer cases requiring hospitalization and for any surgical interventions to a hospital for further treatment. The polyclinics usually have attached medical laboratories, that is clinical laboratories and radiological and imaging facilities to cater to the needs of the doctors working in the clinics. The physical requirements of the clinics are given in the part 2. The hospitals offering basic services and family medicine, that is primary care. These facilities are basically managed by one or more qualified medical practitioners, that is MBBS doctors, and offer basic level services to the patients irrespective of the bed strength as described in the part 6. These may also have an attached medical laboratory to cater to the investigation support needed for the clinical interventions. In addition to the wide range of outpatient services, these hospitals provide inpatient facilities. The physical requirements, including the space, equipment, and manpower needed for these facilities, depending on the bed strength of the hospital, are given in the part 2. 3. Hospitals or nursing homes offering basic specialty services, that is secondary care. These hospitals provide specialist care needed for the treatment of health conditions through the concerned specialist doctors with higher level qualifications in the following specializations, irrespective of the bed strength: general medicine for medical care, general surgery for surgical care, obstetrics and gynecology for maternal care, pediatrics for the child care, orthopedics for accidents and the trauma care, ENT, ophthalmology for eye care, radiodiagnosis and radiotherapy for the cancer care, physiotherapy and dental care services. These hospitals to have functional areas such as operation theaters, post-operative wards, intensive care units, general wards, and also other treatment areas needed for facilitating the surgical interventions of the concerned specialty care. These may have attached medical laboratories, including clinical laboratories and radiological and imaging facilities, to cater to the investigation needs of the specialists working in these facilities, or the services may be taken from outside diagnostic centers. Some of the facilities may have multi-specialty care services The hospitals offering multi-specialty treatment services should have the complete range of equipment and facilities suitable to the area of the specialization. The physical requirements, including the space, equipment, and manpower needed for these facilities, depending on the bed strength of the hospital, are given in the Part 2. 4. The hospital offering super specialty services, that is tertiary level. These hospitals provide specialist care needed for the treatment of health conditions through the concerned super specialty doctors in the following specializations. An hospital may have different bed strength based on the range of services provided: cardiology and cardiothoracic surgery, neurology and neurosurgery, nephrology and urology, gastroenterology and surgical gastroenterology, surgical oncology, neonatology and pediatric surgery, chest diseases and respiratory medicine, plastic surgery. To facilitate the above services, the hospital should have full set of functional areas and special types of equipment suitable to the needs of the super specialty services offered through the facility. The hospital should have intensive care units, ambulatory support, blood bank facilities, communication network, etc., equipped to meet the demands of an emergency case. In addition, the hospital needs to engage well qualified staff with proper training to handle the specialist care required for the patients admitted to. The physical requirements, including the space, equipment, and manpower needed for these facilities, depending on the bed strength of the hospital, are given in the Part 2. 5. Physiotherapy units. The physiotherapy units function as support units to the orthopedic care specialist centers, or the facilities may function independently. These units need to be managed by qualified physiotherapists and to be equipped with a whole range of physiotherapy and rehabilitation equipment. The physical requirements, including the space, equipment, and manpower needed for these facilities, depending on the bed strength of the hospital, are given in the Part 2. 6. Finally, the dental care services. The dental services are offered as the outpatient services through clinics, from basic dental services to multi-specialty dental treatments. The minimum requirements, including the space, equipment, and manpower needed for these facilities, is given in the Part 2.